Hello, everyone. Welcome to Kombucha and OT, the podcast where everyone's a winner. Never know what I'm going to say because I never know what I'm going to say. It's part of the deal. Welcome back, everyone. We are so excited to be here. Shonda, what's been going on in your life?
Oh my gosh, I feel like it's been so long. So many things, so many things. I am going to be a first-time grandma. I don't remember if we talked about that on the previous podcast or if that was a thing. I don't
Oh,
even know.
that's exciting.
It's super
Just think of
exciting.
all the sensory toys and activities you can do as
And
an OT
honestly, that's
grandma.
probably one of the biggest exciting things is to be able to do some OT style stuff with the little grandbaby. I can't wait. So that's the biggest news. Still trucking along, busy as ever with work, as you well know. And I know it's been a little while since we've been on here, probably because of that. So super
Oh,
excited to get back
been
to
a
this.
lot going on. Work is
Yeah.
very, very busy. We both work
Yeah.
at Therapy Management Corporation, and we are in the recruiting department. I'm with campus, and you're with hiring new grads and hiring seasoned clinicians. So it has been very busy because the company is doing awesome and growing. But that also comes with, oh my gosh, a lot of work to do and get things going. And I also moved from one side of Florida to the other. So that's
That's
been
right. I
a
forgot
lot.
about that. I sure did.
I
We're
do have to.
closer now.
Yeah, but we never see each other. We probably see each other less now that we're closer.
It's so true.
I have to shout out to our producer, Cody. He got into the PTA program, and I know I probably said that on here. He is rocking it, and he has all A's, and I'm very impressed with the PTA program. They are
Good.
already they're already doing hands-on stuff, and he's really really excited and loving it. I didn't want him to go into therapy just because mom's in therapy. I want him to choose what he wants to do, and he loves it. So very exciting. And Kombucha World, what's going on with that? I made blood orange. My latest one was blood orange. I had to take a break from it and protect it and keep it um, all protected while I took a break, while I moved, and then started it up again. And it just came right back. So you just put your starter in the fridge. I did several just in case I messed something up, so I'd have lots of backups. And it worked perfectly fine, was able to start it all back up, and blood orange was so delicious. But that's what
Oh,
we're
I
having.
feel like that's going to be one of my faves.
Yeah. And I've got
Love
to
those ones.
and I've learned that the taller amber bottles make it even more carbonated. And so I like less carbonation, and I know you do, but my husband and son like the crazy carbonation. So I've just kind of been playing with that with kombucha. So it just makes me so happy. I do I started my sourdough back up when I moved, and it did fine. Kefir or kefir grains going beautifully, fermenting milk. It's amazing and so delicious. So good for you. And kombucha. All three are back and going. So let's get to the podcast, what everyone's really here for. And I have our kombucha jar. And I'm going to also say we need some more. We had
Yes.
a time frame because we were more on it ourselves. But if you want to send us any topic ideas or things that are going on, or things that I've had people say, oh my gosh, I used one of your episodes when I was talking to somebody. And so we love that too. We love the shout outs.
Oh, I
But
love, yeah, love
um,
that.
kombucha ot at gmail.com. So I want to say that too. Um, oh, this is a good topic.
Which,
Co-treating.
oh,
Co-treating. We haven't talked
ooh.
about co-treating.
No, and I actually had somebody ask me about that the other day and didn't have all the answers. So this is perfect. I love it.
Yeah, well, we might not have all the answers, but we're going to have something to get you started.
Yep.
Because co-treating means if you're right in school and you're like, I don't even know what co-treating is, that's where you're treating the patient, and maybe another discipline is also wanting to treat the patient at that same time. How do you go about that? And sometimes they're a very complex patient or client or kid or whatever it is, and you need two people. And so how
Yeah.
does all of that work? And I will start with a disclaimer because it is different per setting. It's different per company. Some companies you can do co-treating, but they'll say, we don't want you to. Or some companies are like, go for it, it's fine. And then, you just have to make sure with your company that the billing is all good. And when you bill it, some companies have you put in your time you were with the patient. So if the other person was there at the same time and they're putting that time too, you have to see what to do about that. So just make sure that it's legal in your area to do it
Yeah.
and in your setting and with your billing, insurance companies and all of that. And then if it is, then we've done it a lot. So we can talk about co-treating a lot. So I'll start with peds. In the peds sector where I have worked, we were allowed to co-treat, and it could be so what I've done mostly, it hasn't been a lot with physical therapy, but I've done SLP or SLPAs will come in on our treatment session. So maybe it's a child that has a lot of behavioral issues, some unwanted behaviors, and we're working on that in OT. And we have some effective things that are going strong with that
Yeah.
child. In order for them to get the best outcomes with their speech, maybe they come over. So this is honestly a true example. The SLPA would come over for my treatments because I was able to start out with some heavy work, get the child all prepped and ready. And while they're doing that, they're asking the questions and doing the things they need for their side of, um, for their goals. So we were working on totally different things, but we were working together. It was allowed, and we were allowed to bill it. And I just put in my note, co-treatment or provided along with the SLPA and what happened. So sometimes it went very well, and sometimes we had some redirection. But a lot of times I was able to put in my note that the SLPA was able to try to utilize some of that. So now we're cross training so that if I'm not there, or if it's a time where the SLPA is the only one with that
Mhm.
client, they now have some tools to utilize that have worked for us in OT. So that impedes a lot of co-treating happening, and it's usually an okay thing to do. Just of course, make sure it's okay with your company. But I like doing that also because sometimes they also bring things to the table that they've learned, especially when I was new at this clinic. They know a lot of things. So maybe they weren't as versed in the behavioral interventions and modifications, but they're very versed in that child. And so they can give me a lot of information that I can now utilize with my skill set and plug in, and now it's a win-win for everybody. And I'm set up more for success to get the best outcomes for that child. So when we can get to our goal areas. So pediatrics really enjoy the co-treatment. I also, this isn't really co-treatment, but I also liked when at the clinic it was one-on-one kids.
Right.
And so I also liked when another CODA or another OT in the clinic would come over and we would treat our kids together, because a lot of times they had similar goals, or even if they didn't, we could modify everything to our child. But a lot of times the goal was turn taking. Well, turn taking with me is way different than turn taking with a couple of their peers. Um,
Yeah.
you know, changing up the environment, changing up the dynamics. So maybe I've tried 4 things that are working really well. Now let's bring in a couple people and see if it still works well when there's an audience, because there is a comfort zone with me. So utilizing that so that I'm not there to make it the easiest session for me. I'm there to
Yeah.
make
So
it the best
not
for the
really
kid.
co-treating in that, but it
Right.
still is um working together with other therapists and bringing in um other, whether it be like you said, peers, or in kind of like a group setting. I feel like that's always very beneficial, and I would imagine it is a lot different with taking turns with another child compared to taking turns with you. So I can
And
definitely
another
see the
another
value in
child
that.
that has their own set of reasons why
That's
they're there.
right. Yeah, for
But
sure. So
that's
how do
that's real
you
life.
how do you build that? How do you build that? I mean,
So in our
in both
setting,
of the situations.
we were able to both put in our treatment time and document based on our goals. And then I just added that the SLPA was there working on their goals and then how it went. Did we have a couple of times where we had to intervene? Did it go really well? Did the SLPA have any feedback or comments? And I would just throw that in my note real quick. But it was allowed, we were both allowed to bill it. And for that specific child and that specific insurance company, it was perfectly fine to do that. And it actually, we saw better outcomes, which I'm sure the insurance company enjoyed to see too. So that was perfectly fine. And then of course, if it's not a co-treat, but we were just in the same room, we're focused on our kid, our goals, and then our documentation supported that. I would include, with peer, if something went really well or didn't go really well, I would say,
Yeah,
this interaction happened with peer, we did this. So I would, say that, but I didn't have to say we were with another child and therapist. I didn't have to say that, but
right.
I would include peer. I invited brothers and sisters in because that's real life too. And
Yeah. Oh, that's
that
a
was
good idea.
that was really, yeah, that was really beneficial for some of the kids. Anyway, so
And the
pediatrics,
parents, I
that's
bet.
so pediatrics, that's kind of how it works. And then in the geriatric world, in outpatient, I haven't seen it at all. Um, I haven't seen, so it could be something that could be done, but many times in the outpatient realm, you've got three yourself, two or three yourself,
Yeah,
and it's not a group. They're all working on something different in outpatient normally. Um, so like at the hand center, there was, the table in front of me, and I had three different patients working on three different things for their injuries. Um, and that's how they scheduled them.
yeah,
So the PT or that we didn't have speech at that clinic, but the PT or the PTA wouldn't have pulled them from me. That was our time. So I didn't see that a lot in outpatient. Don't even know if it's allowed or not, but I know you typically are scheduled more than one person.
yeah.
But then in our SNF world, we love co-treating. You want to talk about some of your experiences?
I love co-treating in the sniff world because, I mean, with all three disciplines, at some point, even, um, you know, if PT is working on some sort of standing tolerance or balance or, whatever they're working on, and then I can come in and work on maybe reaching or sequencing speech, just so many great opportunities to do that. And the billing, again, like you said earlier, would just be, I would bill my goals and what I'm looking at and document in that manner as well, and then PT, obviously in speech as well. So, but man, the outcome, especially some of my favorite co-treats are CVA, because it's just so beneficial. You see outcomes so quickly, and being able to do that. And you need help a lot of times because, maybe the transfer is really tough and we're really working on, so I could be working on getting to and from the bathroom, toilet, shower, whatever the case may be, and maybe PT is just working on sit to stand. And I don't know, there's just so many ways that you can utilize the co-treatment, and it really does benefit the patient. Loved co-treating whenever it was appropriate, but you have to be careful with the billing for sure.
Well, you're right. Like that, you can't duplicate the services. So you
Right.
said that you were giving out lots of good examples of I would be working on this, but speech or PT could focus on this
Mm-hmm.
because each of us have different goal areas, of course, for that patient. But it doesn't mean we can't collaborate and
Yeah.
co-treat and do it all together. Um, but I'm not gonna talk about their standing tolerance or balance if that wasn't my goal area and that was theirs. I'm going
Yeah.
to talk about the things that they were able to do based on the goals that the OT set up for me.
Yeah.
So, yeah, you don't want to duplicate services. You
Yes.
some documentation systems, you have a little co-treat checkbox, or you just include it in your note, just see what your company recommends there. But billing is, I get my time, they get their time. We don't have to share it. There was a time where we would have to share it, but we don't have to share it now. Co-treating with group is super fun.
Mm-hmm.
Back when we did this, there wasn't group. We didn't do group, but we did group, So,
Yeah.
but now it would be a group, but we would do, let's say, we probably talked about it before, but we would do pizza, and speech had the trivia for pizza, the word games for pizza, the sequencing of pizza. So sometimes they would do the recipe with the patients and have them sequence out what we were going to need, and go through the process of that, fill in the blank, name that tune, whatever it was to get the brain moving.
Yep.
We had
Man, I
that
miss those days.
communication. And then OT's leading the whole table with actually making the sauce, and smushing out your biscuit, making your pizza, shredding the cheese. Like, we didn't do everything pre-made, so that there were things to do and work on depending on their goals. And then PT might bring over their patient and have them stand and go retrieve items, and then they make their pizza. So we incorporated one little, and then the Italian music, the Mamma Mia is in the background, and it smells delightful. And we're all involved, and that could be a group co-treat type session. It could just
Yes.
be a co-treat session, but there are ways to work on their goals together, and it's fun. So that's another way to co-treat. So you talked about neuro and CBA, and sometimes just getting out of bed for somebody takes co-treat. Like, it's a
Yeah.
whole ordeal. And sometimes you have the nurse in there too, monitoring vitals as you get to the edge of the bed and get up. Depending on the patient, we're not there to have them stay in the bed. If they're rehabbed home or rehab anything, they're not there to just lay in the bed.
That's right.
So, that's another way that co-treat's great. And then my favorite's when we can all really work together. So maybe I'm in there, and a PT person, and we get them to the edge of the bed, and then I have them wash their face and freshen up. Or we takes the co-treat to now get them to the chair. Okay, let's all take a breath. We're there. We made it. And then just getting to the bathroom, and then they're exhausted after all that. And that might be the case. And then
Yeah.
maybe we have to get them as part of our co-treat back to bed. And maybe that was a 20 minutes, and we're going to have another 20 minutes to get them up for lunch. So that was the morning. They lay down a little bit. We're going to get them up for lunch, and now speech can come in, and they're up again for lunch. And then they're exhausted. And then, maybe they go back to bed after that, and that could be a progression. And sometimes that is needed. The co-treat's needed because it takes so many hands. And then it's really cool when you can see now speech got a great treatment from them because they were rested and now up for the meal. And then after a couple weeks, then you now see, oh, it only takes one of us to get them up. Oh,
Yep.
they can stay up longer. Oh, the tolerance is better. And because of that co-treat time, we're now successful individually. So
I
we could
think
talk all
breaking that
day
down
about
a
that.
little bit. I know. I think it is. It's so beneficial. And I love talking about that with the neuro, because I just saw so many amazing outcomes whenever we would go in together and treat. I just wanted to break that down a little bit so maybe the new grads do understand on working together. So the transfer PT would be looking at that. They would maybe be looking at the sitting balance. Like you were saying, now I'm going to work on hygiene. Maybe even crossing midline there, just depending on what your goals could look like. There's so many opportunities, and not having to worry about crossing over into PT world, or PT worried about crossing over into OT world or speech world. There's just so many ways that you can do that. And you can get together even in the beginning as a team and talk about that. You have a medically complex patient coming in. this is something that you guys are going to kind of plan for. And then, like you said, eventually getting to where, okay, now maybe we do a little more individualized treatments when their tolerance is better and, they're able to transfer easier. And now they're down in the gym and they're exercising. So, but so many benefits from the co-treatment is, I don't know, definitely the way to go if it's appropriate and you're able to bill for it and your company allows it.
I read recently somebody online said they're seeing more in their setting, more bariatric patients. And I think about many times when I co-treated,
Mm-hmm.
sometimes with the bariatric patient too. And so just getting to the edge of the bed, is tough. But then once they're standing a little bit at the walker with PT, and now we're talking about, okay, what did we learn yesterday? Tell me about your home. How are we going to modify things? Like I'm targeting all the goals I can. And it also takes their mind off how long they're standing,
Yep.
but they're helping me with their goal areas. And then, okay, time to sit. We sit back down at the bed. We haven't even made it out of the room and our co-treat is happening. And then they sit down. We do our deep breathing. And then PT's like, okay, 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 okay. And we're getting up again. And they're at the walker. And maybe this time we try one step forward. And that is scary, but that's what we're doing. Like, that's why we're both
Yep.
there. And then they take a step forward. And now we're going through the goal areas again, whatever my goal area might be. And then, but PT's focused on that. So we've really helped them, but it's also helping that patient because they needed that distraction. And
Yep.
then to see after a few weeks also that now we can go in and do all that ourselves. That's another bariatric patients have a need for co-treat many times too.
Yeah, that's a good point. And I know we did have a couple folks that came in that benefited from that. That is definitely a good point with that. I loved co-treat. It's fun.
When is a time where a co-treat, maybe can you think of a time where it just didn't work out, or trying to
Um,
think of barriers to co-treat,
I
trying to
think
be
like a barrier
comprehensive.
could be being overwhelming. Too many people in the room at once. Maybe the patient feels overwhelmed by that. Maybe you've come in and done some ADLs, bedside, and have built a rapport with the patient and they feel comfortable. And then all of a sudden PT comes in and is like, all right, we're going to stand up and do these things. And that may feel overwhelming for
Good
them.
point. As a new
Um,
grad, you might want to take advantage of the other side of that. You're a new hire there or a student, and somebody
mhm.
already does have that rapport, and then you coming in to help and do your co-treat is your ticket in too. So I could see it both ways, but very
Yeah,
good point. It could be too many people, but it also could be an opportunity to build
yep.
that rapport with them, with
With
somebody
somebody
they
that,
trust.
yep, that's a great
Trust
point.
is huge.
Absolutely.
Trust is huge when it's a situation like that where it's not so easy to just get up and go or bring yourself, many of our patients and outpatient just drive themselves to the clinic, get out of the car and walk on in. That's not always the case when there is a need for co-treat. Usually there's a need because of safety and risk. And so trust is a huge thing to build.
Yeah, it's scary whenever you're in a situation and you really don't know the people there and you're trusting them to essentially move your body, you know?
Yeah, and you can
So,
talk to your patient about it. Maybe the first couple times you saw them, they were already up.
yeah,
And you can say, I'd really like to come in and see how that goes and see if I can offer any suggestions. And you can
yep.
ask their permission too to come in and be a part of that if it's somebody that's really likes that one-on-one.
What
I
about
fa-
you? What barriers would you think?
I think of personality,
Yeah,
differences. If
yep.
if I'm the one that reminds them of somebody else, that could really ruin the other clinician's treatment. If they're so I guess cognition could be a factor.
Hmm. Hmm.
Um,
That is true because there are times to where I mean, I think all of us, if there as therapists, have gone into a room and the the person's like, Susie, get out of here. I don't want to see your face, meanwhile.
But if I'm the calming force, then I could
Yeah,
also see I can usually turn that barrier into a positive. I'm trying not to
yeah,
to kind of be comprehensive, but if I'm the calming one, then me being there
yeah,
and co-treating is the difference between them not getting their physical therapy or not.
yeah.
Me getting them up and ready and then
Mhm.
PT swooping in where we have done this, Sean. Like these are real life things.
Yes.
Hey, Timmy, can you come in and help me? Meanwhile, they hate Timmy, but oh, well, she's asking for help. I like her. And Timmy
Yeah.
comes out. Meanwhile, Timmy's eyes are this big, like she's gonna kick me
Yes.
out. And then I'm like, Timmy, put your hands here. Timmy, and I'm not, they know what to do. They're the
Yep.
therapist. I'm like, oh, good job, Timmy. I'm gonna come over here and clean. I'm gonna take this washcloth and go put it in the bathroom. Now I've left Timmy.
Yeah.
PT is now doing the whole treatment and we're all
Yep.
happy. Like,
Yep.
so sometimes the barriers can be overcome too. And now all of a sudden Timmy's their best friend. So,
Yep.
and
And
those are
that
really,
has happened too.
that
That has
is really
happened.
well, it's happened
Timmy
with you
becomes the best friend.
and some of
Yeah.
my favorites.
What's
They
that?
like you better. I've
Yeah.
had patients like you better. And I'm like, wait a minute, I've worked here 10 years.
Oh, it's been both ways. It's been both ways.
But co-treating is definitely something, if you're allowed to do it, that really will benefit you as a new grad, or you're a seasoned clinician coming into a different setting.
Mhm.
It's just nice to have that option with certain diagnoses, with certain patients, with certain personalities. It's just really another tool that you can pull from to get those amazing outcomes. And that's why we're there. We're there to get them better, not to go pat them in the bed and say, okay, you don't want therapy. I'll see you tomorrow. And then, oh, you don't want
Yeah.
therapy. I'll see you tomorrow. And then tomorrow never comes. So it's just another way to do that. And if you are a new grad, I know we pushed everything off to your company, but most companies do have a rules and regulation or a compliance type department. And a lot of times the things that you're asking, they have a handout or they have an email they can send you that they've been asked that before. So it is okay to ask. And
Absolutely.
you want to, it shows that you want to do the right thing and be set up for success, but it'll give you that information that you'll need and the parameters of how to do it. And that way, it's another tool in your toolbox to be successful as a new grad. So definitely love co-treating. Anything else to add before we wind up?
Yeah, I just want to kind of piggyback on that because that's a good point. Don't be afraid to ask that, and maybe you're the one that brings it into the gym, and
Mhm.
your outcomes change and get better, and you're able to do some co-treatments. Maybe nobody else thought of it, who knows? But don't be afraid to look into it and ask about it, and then present it and see if it's something that may be appropriate for some of your patients.
Yep. And you can use if you're a student, you can use the student card. It would really help me.
Yeah,
Meanwhile, it's going to help the patient for sure. So
exactly.
awesome. Thank you all. And remember, we love for you to send in your stories, your questions, your topics. Kombucha,
Yes.
OT. I don't know how to spell it. I mean, I have to make sure I spell it right. KOMBUCHAOT @gmail.com. We hope to hear from you. Thank you.
Thanks, guys.